Hey everyone, today we are diving into the world of prenatal Pilates. But, this isn't going to be just a list of exercises. We're actually going to get into the why behind all the movements. We're going to create a whole new architectural blueprint for your body as it goes through one of the most incredible transformations possible. So let's get into it. So I want you to hold this idea in your head the whole time. Think about it. Your body is going through a massive renovation. And those old fitness plans you might have, well, they were designed for a totally different building. To stay strong, to stay safe through this amazing change, you just need a new blueprint, one that's designed for this new reality. Okay, so before we can start laying out the rules of our new blueprint, we really have to understand the renovation itself. I mean, what is actually changing inside your body? Let's take a look at the two main forces that are driving this whole transformation. When it comes down to it, it's really about two big things. First, hormones. There's one in particular called relaxin. And yeah, it does exactly what it sounds like. It makes all your ligaments and joints a bit more, well, relaxed. And second, of course, is the amazing physical growth of the baby, which is constantly shifting your center of gravity. You can think of these two as the head architects of our whole renovation project. So with these hormones and this physical growth, how do they actually rewrite your body's blueprint? Let's map out the 4 key anatomical changes that every single prenatal fitness plan absolutely has to take into account. This chart really breaks it all down. So first, that hormone relaxin makes your joints looser. That means our goal totally flips from flexibility to stability. Second, as your center of gravity pulls forward, the lower back can start to overarch. The way we fix that is by using our glutes and core to keep the pelvis nice and neutral. Third, the abdominal muscles can actually separate to make room for the baby. That's something called diastasis recti, so no crunches. Instead, we support those muscles from deep within. And finally, as the baby grows, it pushes up on your diaphragm, which can make that deep belly breathing really tough. So what do? We learn to breathe sideways into our ribs to keep our lungs working at full capacity. Okay, so we get the blueprint now. The next step is to post the safety rules for our renovation site. And I want you to think of these not as limitations, but as really smart safety protocols that are based on your body's new architecture. All right, rule number 1. This one is probably the most critical. After about the 16-week mark, you really want to avoid lying flat on your back for any long period of time. So why is this a red line? Well, when you're lying flat, the weight of your uterus can actually press down on a really important vein called the vena cava. This can reduce blood flow for both you and the baby, and it can make you feel super dizzy. The safe swap is really simple. Just lie on your side, or you can prop your upper body up with some pillows or a wedge. Rule number 2 is all about protecting that vulnerable front line of your body. So no traditional forward crunches, and for pretty obvious reasons, no lying face down. Hey, remember that abdominal separation we just talked about, diastasis recti? Well, doing crunches can actually make that separation worse by causing the belly to bulge forward. So we swap them out for smarter core work. Think about exercises on all fours or maybe a modified side plank, things that teach you to wrap and support your core from the inside out. Now, our third rule. This one might feel a little counterintuitive, especially if you're used to a typical fitness routine. The new rule is to actually avoid pushing your flexibility. And this rule is all about that hormone relaxin. Your body is already extra flexible right now, so pushing deep stretches can actually destabilize your joints, particularly in the pelvis, and that can lead to pain or injury. So the goal shifts completely. We are no longer chasing flexibility, we're building strength through stability. And here's our final red line. Avoid any sharp, sudden movements and any balancing exercises where you don't have support. From here on out, control is the name of the game. So why this rule? There are 2 big reasons. First, jerky movements can create a sudden spike in pressure inside your abdomen that puts a lot of strain on your pelvic floor. And second, your center of gravity is basically a moving target right now, which just makes you more likely to fall. The safe swap, it couldn't be simpler. Move slowly, move with control, and always have a wall or a chair nearby for a little bit of support. All right, so we've covered all the don'ts. Now we get to the really empowering part, what we should be doing. We're going to shift our focus from avoiding risks to proactively building the new support pillars that your foundation really needs. During this entire renovation, there are two muscle groups that really step up and become the heroes of the story. They are your new primary support systems, the pelvic floor and your entire posterior chain, which is just a fancy way of saying your glutes and all the muscles along the back of your body. So first up is the pelvic floor. Now, it's not just one muscle, it's this amazing, powerful sling of muscles that forms the literal foundation of your core. And here is the absolute key. The goal isn't just about raw strength, it's about endurance. It needs to be able to provide constant support for 9 months and then be ready for labor, birth, and recovery. And next up, the glutes, your body's powerhouse. They are the anchor that counteracts all of that forward-shifting weight we talked about. Having strong glutes helps pull your pelvis into a stable, comfortable position, which takes all that strain off your lower back and helps you power through your day. They are absolutely essential.
So we've covered the blueprint, we've covered the red lines, and the new support pillars. But there is one master rule that governs everything else we've talked about. This is the ultimate safety check.
It's a really simple two-step protocol. First, and this is the most important part, get medical clearance. Your doctor always has the final say. Second, you have to become the #1 expert on your own body. Pain, dizziness, any bleeding, those are not signals to push through it. No way. They are clear signals to stop, to rest, and to talk to your doctor. This is absolutely non-negotiable. So just remember, your new fitness blueprint, it isn't about performance anymore. It's not about pushing your limits. It's about partnership. It's about listening to your body, understanding these incredible changes, and using intelligent movement to support it while it does the most miraculous work you can possibly imagine. And that really brings us to our final thought. With this new blueprint in your hands, the real question is, how are you going to partner with your body on this incredible journey? Thanks so much for joining me for this explainer.